Welcome to H&HN Daily. I'm Suzanna Hoppszallern with Hospitals and Health Networks magazine. The transition to ICD-10 diagnosis codes is not that far off. October 2013. Careful planning and implementation are key to becoming ICD-10 compliant and reaping the benefits of this new classification system. Today, I'm joined by Nelly Leon-Chisen, Director Coding and Classification at the American Hospital Association. We're discussing implementing ICD-10. Welcome, Nelly, and thank you for joining me today.
Thank you.
How will ICD-10 impact the patient encounter?
Well, essentially the face-to-face encounter between the provider and the patient will not change. However, every clinical, financial, quality, or administrative system or application that contains the diagnosis and procedure codes that identify that encounter will probably have some sort of diagnosis or procedure code and will be affected by this change. ICD-10 is a more detailed system, so the change will probably provide more clinically relevant and specific information about that encounter. So clear and accurate diagnosis and procedure coding would provide valuable information regarding that encounter, regarding the patient care that provider is.
Nelly, what are some of the benefits of this modern classification system?
Well, because the system is more clinically accurate and more specific, the results would be improved ability to measure healthcare services, increased sensitivity in terms of trying to decide how reimbursement systems would be modeled or methodologies used. There would be an increased ability to conduct public health surveillance. If you're a provider, it would mean having to submit less documentation to support the care provided. You would be able to distinguish between different advances in medicine and medical technology. You would have more socioeconomic information on those patients, including on the outpatient encounters and screening. But more importantly, you'd be able to use administrative data for many other uses, such as value-based purchasing, quality reporting, and to support the medical care that is being provided to these patients.
Nelly, what are some of the financial ramifications of non-compliance?
Well, providers won't get paid. It's as simple as that. If you're not able to submit ICD-10 CM diagnosis codes or 10 PCS procedure codes, by the date of compliance, you will not be able to submit a claim and expect to be paid.
Where should a hospital or health system be with their ICD-10 rollout now?
Well, by now they should have organized their effort. And by that, I mean they should have convened a steering committee. They should have started doing a systems inventory to try to determine how big of a project this is. They should have gotten executive sponsorship to lead this project forward. And so until they do this, they're not going to be able to identify the magnitude of this implementation.
What about by the end of this year? Where should they be then?
Well, there's a companion piece to this, which is the implementation of 5010, which is a new electronic transaction for claims. So they should have finished that by the end of this year. And that's what's needed as the foundation for where the claims would accept the code. So they should have finished that by then. They should have finished their systems inventory. They should have started talking to vendors and also trying to implement those system changes, as well as making plans for training of their coders and other relevant staff.
Thanks for sharing this information with us today, Nelly.
Thanks for having me.
I'm Suzanna Hoppszallern with H&HN Daily. Thanks for joining us.